knock, knock.
Come in.
Hi, my name is Zach. I'll be the nurse taking care of you today. Can you tell me your name and date of birth?
Julia Fisher, January 3rd, 2001.
Okay. Confirm with the wristband. All right. I'm going to do a cardiac assessment today. Do you have any history of any heart conditions or any stent placement, any heart attacks?
No.
No? Are you having any sort of shortness of breath today?
None.
Any chest pain?
No.
Okay, I'm going to do a physical exam. If you'd mind, go ahead and laying just right here at this angle. We're going to
Okay.
put you supine at a 45-degree angle. I'm going to check for jugular vein distension. So if you mind turning your head to the side, I'm going to take a look. Notice that it looks normal, non-distended, it is flat, and then same on the other side. Wonderful. Okay, go ahead and now sit up straight. Thank you so much. I'm also going to now palpate the carotid. I'm going to for you. And then same on the other side. Okay, I noticed that nothing irregular and that the rate and rhythm were good. I'm also going to go ahead and auscultate. If you'd mind, go ahead and breathing in, hold your breath, and now release. And now same on the other side, breathing in, hold your breath, and release. Okay, I didn't notice any sort of shrills or any sort of sharp pitch noises, so that tells me that there's no bruits. I am next going to go ahead and check for your chest assessment. Notice that it is symmetrical, noticing that there's any sort of pulsations around your pericardium, and that it looks normal. I'm now going to listen to your heart sounds, but first I'm going to palpate the point of maximal impulse, which is the midclavicular line, down at the 5th intercostal, and I feel that the pulse is normal. I'm now going to auscultate. We're going to start with the aortic valve, 2nd intercostal space. I hear a love dub. We're going to listen to pulmonic valve, center intercostal space, Erb's point, 3rd tricuspid, which is 4th, and then the mitral, which is 5th intercostal space, midclavicular line. Heard S1, S2, love dub. I'm also going to listen to the bell of my stethoscope at the same exact points. And while I'm listening, I'm just listening for any sorts of kind of murmurs or any third beats, making sure that there's no other sharp pitch noises or crackles. Okay, sound good. I'm now going to move on to a peripheral vascular assessment. We're going to start with your arms. If you mind helping me lift up your shirt. Thank you. All right, I'm gonna take a look at the skin. Notice that the hair distribution is good. The color is normal for ethnicity. Notice that she's warm to touch. I'm going to check the cap refill because she has colored nails. Can't really do it there, but it is less than 3 seconds. And notice that the skin turgor is brisk. I'm also going to feel the pulses and notice the radial pulse. Palpable, even, rate is good. Gonna check the brachial. Palpable, normal, even. I'm also going to just make sure that there's no lesions or varices and all the skin looks good, nothing to note. Gonna move on down to her feet as well and do the same thing on her lower extremities. If you mind laying and kicking your feet up. Alrighty, we're going to do the same down here, just checking for any sort of edema, noticing that the skin is intact, and noticing and just looking for any sort of lesions, varices. It is warm to the touch. It is appropriate for ethnicity. Same thing on this side. Going to as well check the pedal pulses, and also the posterior tibialis. So those are both good. Going to do the same thing as before. We're going to check the capillary refill, less than 3 seconds. And skin turgor is brisk. Same thing as before. No other sort of skin conditions, varices, lesions, any other problems. And that is going to be the assessment.